Okay, I want to talk about the hemoglobin dissociation curve, which displays the relationship of oxygen bound to hemoglobin and the blood gas pressure in the arterial blood. So the thing I think is crucial to appreciate when you look at that relationship and the so-called curve, the dynamics of oxygen moving. So if we look in the lungs, we see that oxygen is gas in the air, 21% in room air, and then there is a pressure drive from the oxygen in the air moving oxygen in the blood. So you can read up about the oxygen cascade. So 21% of 760 is the usual pressure at ground level, and then it cascades down into our throat and into the trachea and in the major bronchus. Eventually you're sort of left with an oxygen pressure in your alveoli of 100, meaning that the highest level of oxygen gas pressure in your blood can be 100, and that's because in air, in alveoli, that's the pressure of oxygen. So the oxygen moves into the blood and dissolves, but there's a limit to it. So then the body has this backup of hemoglobin. Yeah, hemoglobin is a protein with iron in it that's present in red blood cells, and oxygen can be bound to that hemoglobin to exceed the limit of oxygen that can be dissolved. So this is a process that happens in your lungs. But now we're looking at your tissues. So in your tissues, we're hoping that arterial blood has naturally an oxygen pressure, a blood gas pressure of between 80 and 97. So in younger people, usually you see that the pressure is around 97, and as people age, the pressure becomes lower. And eventually goes 80, or could, for really old people, be even lower to that. So what needs to happen is that this pressure of the oxygen is adequate to drive through the gradient pressure with the low oxygen levels in the interstitial fluid and cells, to drive that oxygen to the cells. Now, the oxygen that's bound to hemoglobin doesn't relate to this drive. It's the gas. So what is important to understand is that the arterial blood gas indicates hypoxemia. So if the pressure really becomes low, that means there's a low pressure and there's not much oxygen going to the tissues. But you can see that the hemoglobin backs up the oxygen as it diffuses and can resupply the oxygen so it stays to a maximum of dissolved oxygen and the pressure stays high as possible. So usually it doesn't stay up to that 80 to 97, it goes down, but you want to see significant pressure to maintain the pressure gradient, and oxygen will go to tissues. So what we will now see in the discussion of the oxygen hemoglobin dissociation curve is the relationship between oxygen bound to hemoglobin and the arterial blood gas of oxygen. Hi, I want to have a quick chat about the oxygen hemoglobin dissociation curve. And why is that important? Well, when we following people's oxygen saturation was using a pulse oximeter, it's a good idea to be aware of this curve, that particularly at a critical point around 93 to 94% saturation, if the saturation is dropped, then actually you see a dramatic fall in the blood gas concentration of oxygen. And also I want to look at that the main driver for respiration actually is carbon dioxide, which strongly overrules any drop in oxygen concentration. So let's have a little look at this curve. So there's a solid line, which is sort of the average curve. And then there is a dotted line to the left and a dotted line to the right. So everyone is familiar with oxygen saturations, and normal oxygen saturations are between 94 and 98. There's a little formula, not that anyone seems to be using that, but for the PaO2, so that's the arterial blood gas of oxygen, okay, and that is 109 minus 0.43 multiplied by age. So say 20-year-old will be 109 minus 20 times 0.43, which is about 8.6. So should have a PaO2 of about 100. And similar for a 65-year-old, that would go to about 81, and an 85-year-old 72. So on average, we say a normal PaO2 blood gas is between 80 and 97. At the bottom here, I have sort of listed the normal values for blood gases. So the PaO2 is 80 to 97 for arterial blood, but if you take a venous sample, the blood gas is much lower, 36 to 44. So on average, you say a normal PaO2 for venous blood is around 40. So back to this hemoglobin oxygen dissociation curve. So here we have pulse oximetry values. So 94 is the sort of cutoff point there. We don't want to be lower when we use pulse oximeter, and 100 would be the maximum, but more likely the top people are 98, unless they are on supplementary oxygen, and then you usually see it going to 100. So on the bottom here we have the blood gas value. So the arterial blood gas, we just said, should be between 80 and about 97, but on the graphs you should just go for 100. Yeah. However, once oxygen dissociates from hemoglobin, it can then be taken up by the local tissues. So we see that actually then the blood gas will go down to about maybe 40. Okay. So then we have this one solid line and the two dotted lines. And with this curve, we say that the curve can shift to the left, or the curve can shift to the right. So on here, we see that the shift to the left means the curve will look like that, and the shift to the right, we see the curve looks like so. So what does it all mean? Well, a shift to the left will happen when the pH goes up, so it becomes more alkaline, which is equivalent to saying the carbon dioxide goes down, or even the temperature goes down, but we worry more about that for the moment. So if we look at the situation in tissues, so the tissues, we have a very low arterial blood gas, and we have the situation that the curve will have gone to the left, because in the the curve will have gone to the right, because in tissues we have a low pH and high CO2 from metabolism. So we need to then look at this round circle here. Yep, a low blood gas level for oxygen, and the curve has gone to the right, and you see the affinity for hemoglobin with oxygen is very low, and that's exactly what you want, because you want that oxygen to be let go of by hemoglobin so the tissues can absorb it. And what's the situation in the lungs? So in the lungs, we're dealing with a shift to the left, and we see then that we're dealing with this curve. But in the lungs, we have plenty of oxygen, so the arterial oxygen gas is high between there and there, and so we need to go up to this curve here and here, and we see that the curve is mostly flat, meaning that hemoglobin will bind with almost all of the oxygen available, and that's exactly what you want in the lungs. Okay, so now I mentioned this critical point, 94 point, right? So we see that in the tissues, if we go below 94, the tissues just go to the right, and we see that actually the affinity for oxygen with hemoglobin is around there. So when we're doing pulse oximeter, we do not want to have the saturations fall beneath 94, because what you will see is that the curve will nosedive and the corresponding PaO2 blood gas levels will be very low. So that's the thing to remember, that if you have a patient and the saturations drop from say 98 to 96 and then to 94, the consequence is not that dire. You will still have a good PaO2. However, if you go beneath that 94 level, the curve nosedives, and that actually means that hemoglobin is not carrying a lot of oxygen, and that's of course when we are afraid of hypoxia and even hypoxemia. Okay, now what happens with carbon dioxide? Because you see, carbon dioxide is ventilated out of the lungs and out of the body. Yep, ventilation out, and it is produced in high levels because of metabolism in the local tissues. And it is the carbon dioxide that dissolves in water. It's 40 times more dissolvable in water, I think, than oxygen. Becomes carbonic acid, and then that will form an equilibrium of protons, which make acid, and your pH goes down, and bicarbonate. And going back here, that pH has such a strong influence on the dynamics of hemoglobin binding with oxygen. And what we find that the chemoreceptors for carbon dioxide are the main drive for breathing and can overrule hypoxic or overloading of oxygen. Yeah, so remember that carbon dioxide drive is the most important one, because it's so interrelated with the acidity of the blood, or pH. It also has therefore an influence on the levels of ionized calcium being freely available in the blood. So a good example of that is when you hyperventilate. So the washing out of carbon dioxide is dependent on the respiratory rate. So when you hyperventilate and you ventilate really quickly, you get what's called a respiratory alkalosis. And what that means is that the pH is high, calcium levels in your blood gas will change, and this causes spasticity of your skeletal muscles, and also causes what is called paresthesias, which is those strange tingling sensations that you may experience when you hyperventilate.